Welcome to Sports Doc Talk. I've got our orthopedic surgeon, sports medicine specialist, Dr. Grant Garcia, Will Sanchez. Dr. Garcia, I mean, your background says it all. It's NBA time. I got to be honest with you. I'm a Knicks fan. I'm a little triggered from all the Jordan and Pippen beatings, but I'm gonna excuse. I know you've worked with them in the past, and I know you have some affiliations, so I'm gonna let it go. But before I ramble on and get excited about our show, how are you? And are you a Bulls fan?
I'm not a Bulls fan, so first off, I don't want to throw off the viewers. We're starting to do some stuff. You never know what's going to be on my background. So today we're going to talk about. Obviously, I took care of the Bulls. Working with them was awesome. But the player we're going to talk about today, which we'll go after in a minute, is Lonzo Ball, who is currently going to be starting with the Bulls in, let's say, 3 days. Right, Thursday, I think, is the start of the season.
Yeah, so our
Yeah,
show
big deal.
will be the morning of the start of the season for them. So we're really excited about this 2024, 2025. Like I said, I'm a Knicks fan, so I'm hoping for good things this upcoming season. But for the business that you're in and what we like to talk about, this is right up your alley. We talked about it in the show previously, but before we get into that, because we're going to talk about recovery, and this is kind of what we do, let's talk about the recovery shop. Take it away.
So again, thanks for our sponsors. We've heard this before, but this is what's essential for these big surgeries. You get these big surgeries, patients like professional athletes, regular athletes, college athletes, they were like, can I do? What you're doing is good, but I need more.
Yeah.
Right. So what can we offer? So as a surgeon, we can have a place like this as a landing page, and the surgeons can offer their patients that. They go there, or they get a call from the recovery shop offering these services, and they can buy a bunch of these different things that they want, different advanced ice machines, advanced recovery machines. We got scar creams. We got special bending machines. I mean, pretty much anything you want, you can put on there. I mean, that's the nice thing about this. It's not like you have to stick with something, and it's something you value. So if it's something different that you want, you can talk to them. They can do it. Again, obviously there are sponsors, but I get no affiliation if you sign up. So just, check it out, contact them. As a surgeon, it's always good to have this armamentarium because the patients are going to ask for it. Don't pretend like they don't. You unfortunately have way too many visits where the patients come in, they go, what else can I do?
Yeah.
And you'll say, well, you got this or this. We can offer nutrition. So it's been an awesome outlet for my patients.
Yeah, and let's get started about today's show. We talked about it last year, just the concern, right? And when we're talking about Lonzo Ball, when we heard about his injury, he's had, I believe, three arthroscopic surgeries since the 2021-2022 season, which would be 2022. I believe the last time he stepped on the court was January 2022. So he's finally been cleared after the torn meniscus, which has happened twice, the surgeries. We talked about it. Very concerning. This is something that most likely this player, even at such a young age in his 20s, may never play again. But now there's the chance. He stepped on the court for the first time during preseason. He got a chance to play. Why don't you tell our listeners and viewers more about the injury that leading up to it and the procedure that he had? Because, like I said, we both discussed it, and we didn't think that this was something that he may come back from.
So first off, this episode I'm really excited about. Many reasons. First reason was when we did this initial show, you can go back and listen to it. We did not know that he had his meniscus replaced because it was never announced. We said we had an entire show, one of our hottest shows on the internet, about cartilage transplants.
Yeah.
And we talked all about cartilage transplants, the recovery, and everything else. And then all of a sudden, like 6 months ago, it came out that he had a meniscus transplant and a cartilage transplant, which is a humongous surgery. And that's near and dear to my heart. And there's a couple of reasons. One, this is my absolute favorite surgery to do. This is my absolute favorite surgery to take care of patients. This is a highly niche practice. There are very few people in each state that do this. So this is very cool that I can talk about this in an NBA player. And finally, the most cool part of this is the person that taught me how to do meniscus and cartilage transplants, who did this on Lonzo Ball, is the person that did it to it, Dr. Brian Cole, the godfather of cartilage and meniscus transplants. So, and happens to also be the Bulls team doctor. So this is a awesome conglomeration of everything that I've worked for since I've been here to talk about this and to be able to show off this really cool procedure. Patients know about this. They come in asking about it, and we tell them it's for recreational athletes. Professionals have never gotten it before.
Yeah.
They've got a cartilage transplant, but the meniscus transplant's even the next level. And so now we're about to see an NBA player who's already played preseason, playing his first professional NBA game, the first player in history to have this type of procedure. I think he's the first player with a cartilage transplant and the first player with a meniscus, and they decided to go after both at the same time. And we can explain that in a minute why they did that. But this is a humongous deal. It's a technical surgery, and it has obviously its own risks, just like any other surgery. But let's roll through the slides for the viewers so they can understand what he did. Now, I have inside information. Not only do I do this procedure, but I've done this procedure with the person that did the surgery on him. So I can tell you this is exactly how he did it. So this is really cool. So on the left-hand side, you see the black. And Will, please chime in, because for the viewers, I'm geeking out right now.
Yeah, no, I'm just
I
giving you
need
a
your
little
help.
room to breathe and stuff because I've got some follow-up questions. But go ahead, man. You're like a little kid in the candy store, so
I
go ahead,
know,
play
I
with your
know,
toys.
I know. Okay, thank you so much for the opportunity. So the so the meniscus transplant you see here on the left. So what we do is this is called a
If
slot
you're not
technique.
watching this, and it's a great way to promote our YouTube page. Uh, Dr. Garcia's got a smile ear to ear. I mean, he may hurt his cheeks from smiling so much. I'm sorry to
I'm gonna have to take
interrupt
a
you,
mental break. I'm
but
gonna
go
take a
ahead.
mental break after this. I'm too excited. So, and we got to keep this short because it's supposed to be a blast episode. As you know, we do a good job of that.
Yeah,
So,
okay.
so first off, this is the meniscus transplant. So you can see here now, this is a lateral one. I'm pretty sure he had a medial one. That's more common with the issue he had, but nonetheless,
Okay.
gets his meniscus removed a few times. All of a sudden, it's a hole in the meniscus, a hole in the cartilage, which we talked about, and then all of a sudden has no meniscus left either. The problem you have, and what some surgeons do, is they say, hey, the meniscus is really hard. The meniscus is the hardest part of this whole surgery. So let's say the surgeon skips that, right? That's not good, because now you've lost the cushion. You need to get all three things fixed. The cushion, you need the tibial plateau, and you need the cartilage to be good. The tibial plateau is usually not the issue, which is the bottom part of the tibia right here, below where the transplant is. Then you have the meniscus transplant, and then you have the cartilage portion. So if you fix the hole, you fix the meniscus, and the plateau is good, then you have a good knee again. And right,
Yep.
and that's where the pain goes away and allows you to get back to activities. So the way he did this, as you see here, this is like a keyhole. It's actually crazy. It's just like woodworking. So you cut that hole in, and then you slide the meniscus in like that. But you don't see here, and I couldn't find any images that were not gross for the viewers, so I apologize. But you attach it with stitches. Now that looks like it's really simple, but this is one of the most technically challenging surgeries that we do in orthopedic sports medicine, because of all the nuances and little complications that can occur when you do this. So you do all that, and then on the same time, on the right hand side, and this surgeries happen at the same time. This is not something you do separately and you come back. So Dr. Brian Cole is amazingly skilled at this, and he's very
Yep.
efficient in the operating room. You take a piece of cartilage from someone else that has passed away, generally someone younger. It's unfortunate to talk about it like that, but that's the way it is. They just recently passed away 3 to 4 weeks, so it has to be fresh. And when you get it, you do some things to prepare it, and you actually core it out just like a bone dowel. So you see here, it's a bone plug, and you push that thing right back in. You generally don't need any screws or anything else. It literally just press fits. It's designed in the system to do that. And those two things together are going to instantaneously give the patient a better joint surface. And then you're talking about a long recovery. I mean, Lonzo Ball's recovery was more extended than I would do for a
I think they
regular
said it was
athlete.
18 months or something like that. I mean, that sounds unreal to have a recovery that long for the surgery. Go ahead.
But you know what? He had bone edema. He had other issues going on that
What's bone
I
edema
wasn't.
for those that don't know?
So obviously he's starting to get, like, basically that means the bone is not happy, right? He has no meniscus, he has no cartilage, and he's on that pre-arthritis stage. So if they don't do something soon, this is going to go really poorly, which is why he had so much pain, right? There are
Yep.
athletes, I've taken care of NFL athletes, NBA athletes that have had early arthritis or arthritis in their knees, and they're fine, right? It hurts, but they can push through it.
Yep.
Lonzo Ball clearly had something else going on. The swelling, the constant pain that he had. His knee didn't react very well to losing that meniscus. And it doesn't happen to everybody. He's just lucky that everything else was in his favor. Good ACL, good everything else. So he basically had this special surgery, which again is incredibly unique. It's not unique in general. We probably do. I mean, I think Dr. Brian Cole probably does 60 of these a year He probably does 100 cartilage transplants a year. I do 20 of these a year with cartilage, about 45. So it's not uncommon that we do them. I do one every couple weeks. But to do it in a professional athlete is the next level. So this
Why
18-month
is there a risk
recovery,
in that? I'm going to interrupt you as we go along.
go for it. No, go for
Why
it.
is that something that becomes a risk, and why you normally wouldn't do it on an athlete like this?
So first off, very few people have the cojones to go after be the first one, right? No one wants to be the first one with a surgery like this if it fails, right? Like let's say Lonzo Ball goes out in 2 weeks, and again, I hope not. I don't
Yeah,
think it's going to happen.
yeah.
He's obviously been checked a million times. I'm sure he's had way too many MRIs to make sure everything's looking good. And I'm sure Cole's seen him. I'm sure other people have seen him and make sure that
Mhm.
he's cleared and ready to go, right? There's no way the Bulls are letting him put in an experimental NBA thing and then go after it, right? The surgeon's not experimental, but it's the first time done on an NBA player.
Yeah,
So the idea is that like that's the big problem here, right? That's what we have to worry about. Like what else is going to happen? So what can happen is you can tear your meniscus again, right? The meniscus, even though so that meniscus transplant is from somebody else. It's a cadaver as well. Now those are
yeah,
frozen, and the cartilage is fresh. So the cartilage sustains itself better. Those less likely damage themselves. So other professional athletes have gotten cartilage transplants. There was a hockey player that just recently got it from Brian Cole. There's a few other athletes that have had the cartilage transplant. Those are way more durable. Those are way more solid. Like I do those and I kind of set and forget. I mean, people can have issues with them, but it's just not as often. The meniscus has 3 zones. There's the zone with the blood supply. That's the very far back zone. Then there's the middle zone, and there's the white zone, which is the edge. And you can see that here. When the meniscus transplant heals, and it's pretty crazy. I just scoped someone last week that had a meniscus transplant. You can't tell. All the sutures have dissolved. Everything looks like it's a regular meniscus. Sometimes I grab a nurse in the room and I say, hey, what is this, real or not real meniscus? And they can't tell, right, when we're doing the
yeah,
scope. So they look the same, which is amazing. But because it's been from somebody else, that little layer, the layer without the blood supply, never gets integrated into the rest of the body, and so there's a risk of tearing again. It's a little more brittle, it's a little more fragile than maybe the one you were born with. Obviously, nothing's as good as what we were born with.
yeah, yeah, yeah.
But
And it depends
they
on the
do
age.
well.
And can I assume that depending on the age of where you're getting this transplant from can also be a factor as far as, let's say, like Lonzo Ball is 26 years old, and if you got a replacement from someone that was in their 20s, maybe that is a little bit more stable and stronger compared to someone that's older. Can that be a part of making the decision making when you're selecting that specific part of the body for the transplant?
That's an excellent point. So the answer is we rarely would put something older than 30 years old in a knee like his. I'm
Gotcha,
sure he
gotcha.
got something younger than him. He
Yeah,
got a patient younger than him. It's just that's unfortunate. Unfortunately, there's way too many bad things that happen out there, and we have a lot of these transplants to do. And again, I don't want to go into the ethics and stressfulness of the situation of getting donors, but
yeah,
it's
yeah.
real. I mean, we all know it
No,
happens. It's
hey, listen,
unfortunate.
I'm a donor. God forbid, when my time comes,
Yeah.
if there's anything still working, please take it and use
No,
it for somebody that
and
needs
it's
it.
really nice too. Like what you can do, and you do these. My patients will write letters to the family that
Yeah.
donated, and so you can actually. I've done my. I mean, I did one of my best friend's wives, and she got a cadaver ligament for her ACL, and she wrote a really nice note to the family.
No.
And actually, that's really cool. I get it frequently. My patients do it because I do a lot of these,
Yeah.
and it's a really cool thing you can do. And again, I'm sure it makes the family feel better that they went to a good cause and made a
Of course.
patient feel better and made someone feel better. So anyhow, on back to the topic,
Yeah.
the recovery 18 months is pretty long, but not for athlete of his level. The average return to sport on these is about 10 months to a year. And I have my patients, the thing is, what's crazy about these is he probably felt pretty freaking good by about 8-10 weeks. They don't usually they feel a difference in their knee very quickly, despite how big of a surgery this is.
Yeah.
But he probably had to reduce that bone inflammation. He probably had to reduce all that stuff, and he had to strengthen his knee. And also because he's an NBA athlete, I'm sure they were just going super slow with him. I mean,
Okay.
just as
So one of
slow
the
as
things that
possible.
they mentioned was on one of the articles I read was that he had to relearn to walk. Now, why would that be something that happens? Is it the procedure? Is it the way you want it to heal a certain way? So even though you're saying you're going to feel a certain way 8 to 10 weeks, that you want to make sure that you're not advancing. So why is that?
I'm so glad you're on here, Will. This is great. These are the questions that I just assume people know. So this is excellent. So when you get a meniscus cartilage transplant, you cannot put weight on it for up to 6 weeks or so. So the first four, again, depends on the surgeon, it depends on the procedure you do, it depends on your comfort level, but generally 4 weeks of no weight on this. So, and then 2 weeks of sort of partial weight. I think Cole is very similar. So by 6 weeks, you're walking pretty normally, maybe more aggressive walking by 7, 8 weeks. Right. So that's the thing here is he had to relearn to walk. One, he probably was limping or having pain frequently.
Yeah, yeah.
And two, and generally these patients are not doing very well when they start beforehand. And then he had to learn to walk again. And then he probably was walking abnormally because he was probably hurting, right? Enough that he shut down so many times. I mean, he basically, I don't think he was probably normal with his knee for 2 to 3 years before this.
And who knows if he was normal, or well, we, quote unquote normal, because he had already had an injury prior to the one that set him back to where he's at right now, with that meniscus injury or the meniscus tear prior. So, and also we've talked about it, right? You're laid up, you're losing strength, you're losing muscle, just everything that kind of goes into it, right? We've
Yeah.
had different discussions, not saying that this is something that they use, but we've talked about peptides, we've had different conversations with different people, amino
Yeah.
acids, how do we, get certain things? So, it'd be great to know what was the goodie bag, right? We're going into Halloween, right? To look into our bag of goodies and what did the doctors put in there to try to help him, even though it's such a long process, to get him going as fast as they can.
100%. I'm sure there was more than you could possibly imagine. I mean, I've had to take care of some of these Bulls players, and the screening tests we do for them, are not normal. You're getting like checked for literally everything, right? They're getting way more information. They've got cutting edge technology above what we have, like we've shown before. Guardian caps, Q collar, plenty of other technology that makes it to the NBA much faster than we would make, right? There's no insurance costs. They don't care about that. They have unlimited supply of money.
Oh yeah, yeah.
And they're like,
Yeah.
whatever it takes, let's do it. It's cutting edge. It's not going to hurt the player and it's going to give them a leg up. Let's do it. So they look like, unfortunately, the NBA training rooms look like a science experiment because they've got all these different little potions and things there that we don't even have access to yet. So
We've talked about recovery plenty of times, right? H robotics, Rebelist, things like that. What would be something that they would use for Lonzo in this healing procedure?
So this is what I use as the rebus for this exact surgery. So this
Okay.
procedure. So basically, he gets this surgery, and I'm not sure if Cole used just a standard bending machine or he used. He didn't use the rebus, but another machine of some similar thing. We start using that right away, and that we used to use those bending machines for everything, ACL, you name it. But
Yep.
that's also a little more old school. But now with these machines, you want the patient to get bending because as he bends, he puts fluid through his knee. It's like lubrication and it
Yep.
gets the things moving. And he wants to put a little bit of bend on it because it actually pushes that meniscus out to the capsule where you want it to heal to. And with the transplant, it keeps it flush, right? So he's checking that before he finishes surgery. He's going to rescope the knee, be like, that all looks perfect. Nothing's moved since I bent the knee. And then he's going to let him bend his knee to try to get him back because you want him in like week 1 or 2 to have very little pain and to be really moving that knee really well. Like by week 6, you want him to let him loose and you're going to say, go to full motion and you want him walking, smooth glide, no issues.
All right. So it's not Lonzo's leg, right? So I'm going to take Lonzo's leg out of it. Dr. Garcia has just had this operation done. What's the normal? And I know everyone is different. So just for our listeners to take it with a grain of salt, what's the normal progress for the bend? So if the leg is straight, completely horizontal, you know, that week, first week, 2 weeks, whatever it is, what's the degrees that you start to implement? And if everything is on par and going the way you want it as a doctor, when do we get to that 90 degrees in that time frame?
So it's actually fairly quickly with these, which is pretty impressive.
Really?
I mean, I
Okay.
would say I let them go all the way to 90 if they can in the first week. Now, most people can't the first week if they get swelling. Everyone's
Yeah.
different, like you said. But I let them go to 90, and I want them to keep going to 90 repetitively because, as you know, after a surgery, especially a big surgery, your swelling is going to keep coming back.
Yeah.
So you got to, if you set it and forget it and then you stop doing it, it's going to lose motion again. So you have
Gotcha.
the motion of the knee and the motion of the shoulder, but really mainly the knee for these surgeries is so important. It's so important that that's why we give people these machines so they can do bending. I mean, my patients talk about falling asleep in the machine. So they're just falling asleep and they get 6 to 8 hours of just bending their knee while they're sleeping. And that's a really, really good thing for the knee. There's no damage caused by this. If you're worried about damage, then you did the surgery was not up to par. So it's really important to have that aspect. So it's a good question. So then progress for me outside of the bending, walking fairly normally at 6 weeks, 7 weeks, that's when you start to be like, hey, how you feeling? Really that like up to 3 months is when you start to really notice a difference in your knee. 3 months doing some elliptical ish stuff.
Okay.
Running is going to be like 5, 6 months. Now, again, this could have been delayed more with Lonzo Ball.
Yeah.
And then you have sort of the high impact stuff, 7, 8 months, full return, 10 months to a year, but 18 months is not considered abnormal. I mean, I've had patients that have taken 14, 16 months, even just from the transplant to get back. So
Wow.
that's what I tell people. The return to sport date is 10 months, but not everybody's the same. And a high level cutting basketball player is different than my patients who want to hike Mount Rainier or want to
Is
go
that your biggest
hiking.
concern with this surgery for the basketball player? Right? We're talking about one explosion to the basket or that quick cut, quick shift. He's a point guard. I'm not sure how much they're going to play him at the point guard, which means you're stopping, starting, accelerating, coming off the pick and roll, things like that. So, what are your concerns when you're thinking about your lateral to horizontal movements? If you're looking at this player or your patient, you're going, okay, this is what I want to see when he's doing, X movement.
Yeah. So, I mean, that is by far the most. I mean, you have a young 20-year-old NBA level basketball player who's going to be playing all out. I mean, he's going to be scared. That first 6 months, I don't think you're going to see him at his number one.
Yeah.
There's just no way because he's going to be too concerned about damaging this. It's been 2 years. We've talked about this before. There's a massive mental aspect to this. And I mean, this is a guy that his livelihood is required, him to be able to continue on and do in the NBA and do stuff he loves, but also get paid. He's got to be able to play well. And now he also has to worry about his knee because he's now the first one ever in the NBA to have this. That being said, this is not a surgery that is experimental. This has been around. I mean, Dr. Brian Cole has done this for like 15 or more years, right? He's done over 800 to 1,000, right? This is not no offense to Lonzo Ball, but he probably did this as like he had his morning coffee and then he walked in and he did Lonzo Ball. That's
Yeah.
the type of guy that
Yeah.
Brian Cole is. So this is not something that we should be stressed about the quality of the surgery, just that it's unknown. And I mean, there's plenty of athletes I've done this on that have done really well, but never professional,
Yeah.
obviously.
Yeah.
Or but that cutting maneuver is a concern. That's what I'm watching out for. You may get into this, but the two biggest things we worry about with this, the number one, and I hate to say it, re-tear of the meniscus transplant and it can happen. It's like 10, 15% in the first year. It can be up to, so 75% of these transplants are still intact at 10 years. The problem you have is you have that's in general, right? So I have my 40-year-old patients I do this on, and they're not going back to high level cutting sports.
Yeah.
So
Yeah.
he may not last as long with this new meniscus. But again, if we get him 3 or 4 more years in the NBA, that'd be amazing.
Yeah. That'd be interesting. I'm looking forward to. Obviously, I'm a sports fan, basketball fan. I want to see what his minutes restriction will look like. Especially in the beginning. Obviously the league is always talked about, especially the players nowadays with the back-to-back games. I would be shocked to see him in any back-to-back games. But it'll be interesting to see what the progress is from when, and maybe at the end of the season, we're talking about the NBA finals, maybe some key injuries or NBA playoffs. We could kind of look back at this injury and, whether the Bulls are in the playoffs or not. They have a young team, and we'll see kind of what happens with them. But kind of say, hey, got through the season. Hopefully, we're saying got through the season. Went from, 6 minutes a game, no back-to-backs. By the end of the season, he was up to 22 minutes a game or something like that, able to contribute, looked like things like that. And I know we're starting to go long here, but, um, where are you feeling as a doctor? What's that over the hump, right? Because you already said there's always a chance of tear, right? And it almost seems like you'll be surprised if there wasn't, especially with this high impact. But
I
where
mean,
do
if
you
I did
head
this,
to?
I'd be nervous all season, right? If Brian Cole, I know is able to, he's a cool, calm guy. I love
Yeah,
him. He's awesome. But, and I don't think he's nearly as stressed as I am watching Lonzo Ball play, just because I know the level of the surgery and the level of 2 years of recovery and obviously being the first one.
yeah.
Um, but
So there's not a point
yeah,
there where you go, well, he's up to 20 minutes. He's reacted well. Obviously, I can't imagine how many times he's being checked in, right? At this level that Dr. Cole's checking in on him, how you feeling, what's going on. Okay, let's get you ice. And this is what I want you to do when you come off the court and after the game and before the game, like this whole process. I can't even imagine what goes into it. So there's no point of it where you go, all right, anything can happen, but overall, I'm kind of feeling pretty good where we're at, and everything else is just kind of we'll see.
well, so I think to me is he's had a long discussion with the agent, I'm sure, family,
Hmm.
Alonzo. Cole had discussion with many other different surgeons too to make sure this call was the right call. And I think it is because this has not been done before and it needs to be done. I mean, you have players, this is a humongous first start. And I think that there's not, I think that as the games go along, there's gonna be less and less stress. And you're gonna see that if this works, Lonzo's gonna be playing better than he's probably played in a while. Because
Pain
when
free.
patients get this, like this is one of my highest. The reason I like this surgery, I already told you, it's extremely challenging. It's a really niche thing that very few people do. But when you do it right and well, the results are mind boggling. I mean, you get patients that are miserable with pain,
Mm,
swelling,
yeah,
frustration, and you can make them feel stable. They have this thing they call stability, which is very weird because they're not actually unstable, right? They have normal ACLs, and you can make their pain go away and they feel like the fullness of their knee feels better, right? It's like a car, and they're like, you're driving, you feel like something's missing, like the belt's not working right. You can just feel it clutching, you feel
yeah, yeah,
something weird going on.
yeah, yeah.
When they get this, they go, my knee feels different. It feels strong. It feels stable. It feels not swelling. It's not painful.
Hmm.
These are weird comments that you don't hear when you do other surgeries. Like I do lots of other procedures. Thank you. I feel better. My pain's better. But they can like put their mouth on it. They can put their words to it, and they can say, this is what this is.
Yeah, yeah,
And if he gets that, and again, it happens more frequently than it doesn't happen, that'll be so cool. I think we're going to see some
yeah,
impressive things. And I think that, we're talking about 10, 12 games this season. He's following the restrictions, slowly improving. We're going to see some pretty impressive things. And I'm confident in this procedure. I hope he does really well. And even worst case, I'll let the viewers list this. Even worst case, if he does get a small tear at the end of the season or something that gets cleaned up, it doesn't mean that it's a failure, right? Because he's still going to have a lot of his meniscus left. He's still going to have that cartilage transplant, hopefully.
yeah,
And
yeah,
so even a small hiccup, it doesn't mean that you're failed,
yeah, yeah.
right? Most of these cleanup procedures, you still keep going. So I know we can go all day with this, but I'm really excited about this. Obviously, I think that it's really cool for the listeners to understand this. The last piece I'm going to tell listeners, be prepared. This is not going to be the last person that gets this surgery if this works in the next year,
Yeah.
because there are so many other athletes that need this done that no doctor wants to do this surgery on them because they're terrified. So because they don't want to have this fail, right? This is a higher complication rate than an ACL. This has a higher complication rate than a meniscus cleanup, right? It's got all of the things. But if this works and gets back a player that has this is career ending, you're going to see not a flood, but this is going to be something you're going to see every year in the news after this. Just I again, I could be wrong, but we'll see.
It'll be great to watch. Just as we wrap it up, we think about injuries and what's happening on the court, and you've had injuries, I've had injuries, and probably everyone that's listened. It's not just the injury of what you're doing; it's laying in bed, it's trying to sleep, it's trying to be comfortable, it's just being uncomfortable and having this issue with whatever it is, whether it's your knee or elbow or neck or whatever. So just having some something there that kind of will make him feel better, and even sleeping right, maybe getting your full 8 9 hours of sleep and everything else. It's got to be beneficial for physically and mentally. So we hope that everything goes well, and we know what it is to just be in pain, right? And that's so one of the reasons that we talk about the
Yeah.
show. Being in pain is not fun, not just walking, but even doing nothing, you can be in constant pain.
Well, and again, for this one, it's not, he probably wasn't in pain constantly. These, most of my patients are athletes, right? They're like, it hurts when I run. It
Yeah.
hurts when I do sports. And that's what we're here for. Sports surgeon. I want to fix you so you can do sports again.
Yeah.
But I also want to let the listeners know, thanks again for all the requests. I've had 3 patients in the last 3 weeks ask me when this show was going to happen. And I didn't tell them I was going to do it. So people are waiting for this Lonzo Ball show to hear about it. So
We had
I've
to
been
wait for
excited.
the start of the NBA season, right?
Will's been
Opening night.
excited. But
Opening
anyhow,
night, we had to come back to this.
thank you to the listeners
Yep.
for continuing to encourage us to do stuff like this, because this is what it's all about. Want to teach people about this surgery. People come to me, they're like, this is so new. I'm like, it's not new, but you just haven't heard about it. So we're going to inform you and learn. So thanks again.
Yep. And please check us out at sportsdoctalk.com, because that's where you can put in your requests for other shows and anything else you want to listen to. You can check out our previous shows, transcripts. You get tired of listening to us babble, but you love the information. Check out the transcripts of the show. We have everything there. So we appreciate you guys. And let's go Knicks. Let's see if we can finally win one. It's been damn too long. It's been since 73. And I don't want to have to talk
Uh,
about John Starks anymore, missing all those
no, and
shots.
I'm not going to, I can't root for the Bulls, but I'm going to say go Lonzo. That's going to
Go
be
live.
awesome.
No, we always root for our guys recovering, things like that. So, Dr. Garcia, this is great, man. Thank you so much. You have a good
Thanks,
one. Say
guys.
bye.
Bye.